ICB will be divesting itself of its responsibilities, stand to potentially increase the local authorities' demand? What we could see is pressure being brought to bear on adult social care budgets as a result of unintended consequence of some of the decisions that are made, if those decisions aren't made in partnership.
Yeah, and as you know, this is a national decision. I think other ICBs are flagging the same risks. We are waiting for NHSE to sign off our plans. So you're right to say it's been submitted. They need to give feedback. We're then hoping for national clarity in terms of what the next steps are and what the process of engagement is as well. So you'll understand we have to operate within that framework. When we are able to share, we will of course share, and more than share, we need to consult and understand impact. And that's not just about how we move forward, but I think that sort of sharing of concerns and sharing of intel on impact is really important for all of us in determining the right way forward. But I will stress again, in some regards, this is out of our control because it's a national programme. We are dependent on that guidance. We are dependent on their timelines, and we are dependent on their direction in terms of what can be shared where. Ros, I don't know if you want to add to that in terms of how we move it forward.
I just think the only additional thing which Laura, you are also involved in, is that of those services that particularly those ones that are looking to potentially transfer elsewhere, we've set up a number of groups with local authority colleagues, so with Laura and Simon and Ashley Whitaker, to look at what the model might be, what the timelines might be, what any opportunities are, what risks are, and what unintended consequences there are. So those are the purposes of setting up those working groups over the next few weeks, so that we really do that together, because we know we have to do that together for precisely the reason that you're saying, Laura. We just have to really be aware of any unintended consequences and the risks of that and how we mitigate it.
Thank you, Sarah.
Thank you, Chair. I was pleased to hear that you are keen to involve communities through neighbourhood care and decision making over commissioning and being involved in that process. I was wondering if you could give some sort of practical examples of what that might look like, if you can sort of say at this stage. And on the back of that, what that looked like for the decision over the Mountbatten commissioning. What was the involvement with communities? What's the getting feedback from people? How did that work for that decision, and how might it be different going forward?
So I'll pick up, Sarah, thank you. I'll pick up the neighbourhood point first. So what we are currently doing with neighbourhoods is we met with all of our GP practices across Hampshire and the Isle of Wight last Wednesday, and we've now launched a locally enhanced service, which is about clinical models such as proactive care, home visiting and same-day access. So we've created the commissioning framework for neighbourhood care, and we're now having conversations with our practices and PCNs on the island in terms of how will we deliver the model within that framework, how do we involve other partners. Once we're clear on that operating model and how we move forward this year and next year, and as Ros said, one of the key conversations tomorrow is with local authority colleagues in terms of how they want to align and partner moving forward. I think that then gives us a great opportunity by which we can engage with our community around our future model of care and sort of moving it forward. Joanna will know, because Joanna's involved in the health watches across Hampshire and the Isle of Wight. We're really keen for the health watches to support with the public engagement and the evaluation of integrated working moving forward. So starting from a fresh page, if you like, we've put the investment in place. We're shaping the model clinically. We then would like to engage with our community around what that means, and then use our community organisations to drive the evaluation of that moving forward.
Thank you, James. Just to touch back on the decision over Mountbatten, it seems like that decision has already been made, and then there's going to be consultation with communities. It seems like that's quite a big decision to happen ahead of having that engagement with the community. Am I understanding that right?
So yeah, and I'm picking up so you're aware of my role, Sarah, and what I've done previously. I am picking up the issue with Mountbatten. So what I can say on that is that we've absolutely heard the feedback, and we've been in dialogue with the hospice. I visited the hospice and met with myself and the organisation's, the ICB's chief financial officer, met with the hospice on Monday, the chief exec and the deputy chief exec, and we had what I thought was a really open, honest and constructive conversation around the potential impact of these changes, the entirety of the service that the hospice offer, what the opportunities are moving forward. And what we have done following Monday is agree a number of key lines of inquiry in a series of meetings over the next couple of weeks to start to understand these issues in more detail and start to have conversations in terms of future direction. So I get the frustration in terms of previous consultation. I absolutely get the concern of residents in terms of how these decisions have come to pass. What I can give is my absolute commitment for me and my colleagues to work with the hospice now, understand the impact, and we've agreed a path of meetings over the next couple of weeks. So we're hoping that over the next couple of weeks, as we get to the point we get to, we clearly update stakeholders, and then that will determine how we engage moving forward and what that means for provision in the future.
Thank you. Any other questions from anybody else on the committee? No? I just need to check with the committee that we have here that to note the report or to put forward any recommendations based upon the information heard at the meeting. I do think as a committee we should note our concern that this is a huge change, having seen all these discussions on reduction of running costs and things like that. This seems to be a change that's being brought forward really quickly. You know, when you've looked at reducing running costs and ICB and the changes and all of that over the years, this does seem a huge pressure on the ICB to do this on what does feel like a really tight timescale. So could we just have a show of hands? Is the committee okay to say that we note the report, but we also would like it noted that we have quite grave concerns that it's a huge financial reduction in a very short timescale, and although that this is reducing running costs, we as a committee cannot see how ultimately it will not affect services. With that, could we have a show of hands if we're happy with that recommendation? Thank you. Thank you ever so much for your time. I'm sure we will see you again, because this is now the first part of the meeting, which is like the old health scrutiny meeting. We are a decision-making board, but we will make sure that we keep asking you along, and we will treat you as gently as possible. Hopefully you will understand that and want to come back and talk to us again.
Yeah, and sorry,
else you would like to add?
only to say sorry we can't be there in person. We prefer to be there in person, and often we are, but clearly the issues with travelling today, and I'm conscious the island's very busy.